Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. And today's episode is actually an episode we decided to push forward because there's been a recent announcement from the FDA regarding breast implants, breast implant safety, and a new cancer associated with breast implants known as breast implant associated squamous cell carcinoma. Now, for years, we have been concerned that breast implants may contribute to breast cancer. There have been hundreds of studies, thousands of patients that have been studied, and thus far, there has never been a link between breast implants, saline or silicone, and breast cancer, that is cancer of breast tissue. However, sometime about probably a year or 18 months ago, there was a new cancer that was associated with implants, and it was known as ALCL, breast implant associated anaplastic large cell lymphoma. And it was a lymphoma of the capsule surrounding the implant. Now, let's get into some anatomy and some details because it matters. When you get a breast implant placed into or behind a breast, the implant is, whether it's subglandular under the breast tissue or submuscular under the muscle, the minute the implant goes in the body will create a shell around it. That shell is called a capsule. Your body is very, very bright, and it knows that whenever there is a foreign material, a pacemaker, a prosthetic knee, a heart valve, whatever, your body knows to wall it off, separate it from your normal tissue, and it creates that scar tissue known as a capsule. Now, the degree or the quality or the kind of capsule you generate varies from person to person based on their predisposition. Some people have super soft capsules. You can't even tell they have a breast implant. Some people, their capsules become really hard and thick, and it's called capsular contracture. That in and of itself, the various types of capsules, is not dangerous. It's more of an aesthetic issue. My breasts look hard and round and fake, and or a discomfort issue. It causes me discomfort, pain, burning, etc. But until now, it's never been associated with any type of real danger. Now, about a year ago, or I don't know the exact date, there started becoming more attention towards a unique, very rare, again, now both of the things we're going to talk about are incredibly rare, but not non-existent. A type of cancer that was associated with not the breast tissue, but rather the capsule. So this is a cancer of the scar tissue around the implant, not breast cancer. So ALCL, anaplastic large cell lymphoma, has been noted in the literature, and now we have probably around 1,200 cases worldwide. So 1,200 is not nothing. It also isn't thousands and thousands, given the number of thousands and thousands of breast implants that are out there. I mean, millions. So what that meant was that people who had breast implants, an incredibly rare case, a small, tiny percentage of them could form this cancer of the capsule scar tissue. So we had all kind of gotten to know that. Well, as of a few days ago, the FDA made yet another announcement. And now there have been approximately, I want to say 20 cases worldwide in the literature of a different type of cancer of that scar tissue or of the capsule. This is breast implant associated squamous cell cancer. So we have anaplastic large cell lymphoma, and now we have squamous cell cancer, both of which are cancers of the scar tissue and not of the breast tissue itself. It's early, and it's obviously even more rare than ALCL, but again, something that one needs to be aware of, because if you decide to do this, it's always good to be informed. Obviously, the risk of crashing when you drive a car is high. Drunk drivers, people texting, etc. But you still drive a car. You just know this probability. Same thing with flying an airplane. So Should everyone run out now and suddenly remove their implants? No, that's absolutely incorrect. If you are the type of person that, based on the information I gave you, these incredibly rare instances, you feel, oh my God, I'm always going to be worried, then go take your implants out. But again, you don't stop driving because a certain percentage of people get into car accidents. It's so infrequent compared to the number of times you drive that you just accept that risk. So this is a very personal experience, but we definitely, as a plastic surgery society, do not suggest that you just run out and take out perfectly normal implants. Okay, so, well, how the hell do I know that I have it? So it turns out that this is the statistics we know thus far. Most people present with these cancers in their 50s, somewhere in their mid 50s. Most patients have had their implants in for 10 to 20 years. Now, if you came to me and you said, I want a breast dog, I'd say that every 10 to 15 years, you should replace them anyways. And here's yet another issue. So it isn't something you get your implant and then boom, tomorrow you get this capsule related cancer. The next thing is, how the hell do I know that I have it? If you're telling me I can just leave my implant in, well, how do I know I got it? So you don't just show up and boom, you have it. There are signs and symptoms associated with it. So the overwhelming majority of people present with what's called a delayed swelling or seroma, which means, and it's often one breast, means, God, it's so bizarre. I've had my implants in for 18 years. My right breast is really swollen in comparison to my left. It seems like there's some fluid in there. So delayed swelling, discomfort, there's a lot of pain in this breast. Often it's associated with redness and that capsular contracture that I mentioned, which is the hardening of the breast. So it's a long-term delayed process. The ALCL, which we talked about last year, has at this point been associated only with textured implants, implants that have, and the outside of the implant is textured like sandpaper. And as a result, the implant was removed off the market while we do more investigation. This new, even more rare cancer, the squamous cell cancer, thus far, the 20, well, it's actually, I think, less than 20 cases. There hasn't been a clear distinction, and it has occurred in smooth as well as textured implants. Saline silicone is irrelevant. So it doesn't matter if it's saline or silicone. You can forget about that. So, well, how do we check? Well, if you have the symptoms I described, the swelling, the redness, the pain, then you go to your plastic surgeon or to a plastic surgeon, and they'll send you to go get a workup. That workup includes an ultrasound, maybe an MRI, a PET scan, and fluid maybe taking out. If you can get access to the fluid around the implant, you send that for cytology. So the last question is, all right, well, shit, if I get this and it's really rare, but I get it, how do they treat it? So breast cancer, cancer of the breast, requires lumpectomy or mastectomy, requires for you to cut out the breast tissue, either some of it, lumpectomy, or the entire breast, mastectomy. These two cancers do not require that. Again, listen, these two breast cancers, rather, excuse me, these two cancers are not breast cancers and are cancers of the capsule. So naturally, the treatment is what's called en bloc, which is fancy for a complete capsulectomy. Your surgeon must remove the entire capsule. Well, I do that anyways when it comes to revision breast surgery, and it's something that can be done with great ease. You remove the implant with the entire capsule, and depending on when you catch it, early, middle, late, it can be completely curative if you remove the entire capsule. So while it is obviously disturbing, like nobody likes to hear that, 20 people is still 20 people. Granted, there are millions of people with implants. I think everything is about perspective and taking things into consideration and being rational. So you're watching TV, the news, an airplane crashes, God forbid, 250 people die. For a period of time, you will be skeptic and kind of a little bit, not skeptic, rather a little concerned about flying, but you're not going to not go visit your parents. I don't really know anybody who stopped flying as a result of the occasional plane crash. You obviously take that risk as a part of flying. Now, if every week planes were crashing, then you wouldn't fly. And I think that's sort of similar to this development of these cancers. I think they are absolutely real. I think that you absolutely need to be aware of them. I think you absolutely need to make an informed decision. But I don't think at this juncture, this percentage probability risk is so great that it leads to removal of or prevention of doing augmentations. But as always, it's incredibly personal. So some people may find this sufficient information to be like, I don't care. Versus some people like, I don't care. I'll willing to take the chances. So at any rate, I thought it was really important for us to have this conversation because I know every time there's a FDA warning, breast cancer, it's not breast cancer, it's breast implant associated cancers. And I think it's good to be informed and knowledgeable. At any rate, that's this episode. As new kind of current affairs occur, we'll always try to talk about them right away so people get some reasonable, I think, sort of analysis of what the context of the information, so they can make good decisions. At any rate, that's another episode of Plastic Surgery Uncensored. As always, I'm your host, Dr. Rady Rahban, and I look forward to having you listen next week.